My name is Dr. Weiss. I'm a cardiologist from the United States of America. I trained at the Arizona Heart Institute in the Columbia system, as well as the Arizona Heart Hospital. I practice a style called integrative cardiology. That means supplements, herbs, exercise, diet, pharmaceuticals, whatever it takes to get the best outcomes. Using ubiquinol as a cardiologist, there's three main effects that I see that I really need for my patients. The first one is in the reduction of oxidized or spoiled or rancid cholesterol. In essence, LDL is protective and good for you. Oxidized or spoiled cholesterol is bad for you. So I use the ubiquinol to protect the LDL from oxidizing and to bring down the amount of the oxidized LDL. That oxidized LDL is the #1 predictor when you're looking at cholesterol of both heart attacks and heart disease. So it's very important to keep that in check. The second relates to that as well, and that's called endothelial function, repair, and protection. Endothelial function, the endothelium is the lining of our blood vessels. When it becomes damaged or fragile, you get more heart attacks, you have problems with hypertension, so on and so forth. We know ubiquinol, this reduced form of CoQ10, is protective as well as reversing of problems in endothelium. The third is both the protection and the treatment of heart failure. Some patients, whether it's from heart attacks or other issues, their hearts get weak over time. We know ubiquinol from research helps keep it from getting weak, but also when it is weak, it helps it to function better and even improve the way that it's outputting blood. So those are my three main functions for ubiquinol with my heart patients. There are two classes of medications we're particularly concerned about as cardiologists in reference to ubiquinol. The first is beta blockers. The second is statin medications. These medications inhibit our ability to manufacture ubiquinol. What that leads to down the road, we think, are problems like dementia and diabetes and heart failure. So if you are on one of those classes of medicines, a beta blocker or a statin, I would look at 200 to 400 milligrams of ubiquinol in the morning, depending on how much of the medicine you're on. Dosing ubiquinol seems very complex on the outside, but it's not. So let's simplify this. Okay, if you're just trying to prevent heart disease, 100 milligrams of the active form is plenty. You don't need 200 to 400. That's regular CoQ10. When you have the active form, 100 milligrams in the morning is just fine. Now, let's say you're a person who's been diagnosed with heart disease, has had bypass surgery, or maybe a stent. Depending on if you have any heart damage is how you're gonna dose your CoQ10. So if your cardiologist said, nope, your heart was just fine, we got to you in time, then you're looking at 200 milligrams of the ubiquinol in the morning. Now, if you've had a little bit of heart stress, you had that heart attack and there's a little bit of damage, you wanna move right to 400 milligrams in the morning. Now, I will dose it one of two ways. I will dose 200 waking and another 200 around noon, but my patients don't like to take that noon dose. So usually I do 400 milligrams in the morning. And I find that to be very, very protective because we cannot let that heart get any weaker. Now, the third stage for heart patients specifically is going to be when you already have a weak heart. And when you already have a weak heart, you are solidly in the waking up having 400 milligrams of ubiquinol and then 200 milligrams either at noon or dinner. You need that 600 milligrams a day. The reason is when those hearts get weaker, it is tough to get them to be stronger again. So we have to prevent them from slowly getting weaker over time. And that's what we see in patients who are not on ubiquinol. But when you're in that 600 milligram range, I am very comfortable for your safety. The newest category is when you look at your nervous system disorders. When you're looking at Parkinson's, dementias, those patients are at 1,000 milligrams a day. You are around 400 in the morning, another 400 at dinner, and maybe 200 at bedtime to protect the brain and even to, and many people, help protect them from seizures. So I think the uses of Ubiquinol are gonna grow, and I think they're gonna grow exponentially, and they're gonna largely be in three fields. The first one's gonna be in your chronic fatigue, Lyme disease, those folks. We have to rehabilitate that mitochondria and get that making energy again. Ubiquinol, to me, is the ideal choice for that. The second is gonna be in nervous disorders. There's your Parkinson's, your dementias, your seizures. Years ago, our American FDA said Ubiquinol for a tremor called Huntington's chorea in 1,000 to 1,200 milligram range. Those tremors were significantly coming down. So we need to pull that research back and really support those patients. And I think the third is going to be in your sports recovery, or guys like me, I'm 54, when I go out and I'm a weekend warrior and I'm sore and I'm trying to get my muscles back, well, we tear down those muscles when we're working out. We need to rebuild them. That requires that mitochondria in those cells to fire up. Well, that's Ubiquinol. That's what helps fire these mitochondria up. So I think those three areas are where you're going to see Ubiquinol use really grow. CoQ10 in the early years, when I first started practicing, it never worked quite right. It looked great on a chalkboard, but clinically, patients weren't feeling better. We weren't seeing the successes. And later on, we realized why. We were taking in an inactive form. So when Ubiquinol came out, that's when we first started to see the real clinical effects. We saw the endothelial function, we saw the oxidized LDL benefits, but the really cool thing was patients could feel it. When they took in the Ubiquinol, we kind of hoped and we weren't seeing anything. We're like, well, it's a really good idea. But when the Ubiquinol came on the market, they're like, Doc, I have a little bit more energy. So in medicine, we like two things. One is we like the patients to feel better. That's good. Ubiquinol checks that box. But we also like the labs to improve. We want the oxidized LDL numbers to go down. We want the protection from the heart failure. So when Ubiquinol came out, it was a huge leap for us because the doctors got what they wanted and the patients felt better.